According to the National Institutes of Health, pain affects more Americans than diabetes, heart disease, and cancer combined.
Pain is also the most common reason for doctor visits, and it's a major contributor to rising healthcare costs.
On this week's Health Talk, we'll talk with a pain management specialist about healthy ways to manage pain.
So please join us for some very important and very practical advice.
We're up next.
Hello, I'm Dr. Eric Mazur.
And I'm Dr. Andrea Peterson. Today we're talking about healthy ways to manage pain with Dr. Pooja Shah. Dr. Shah is an anesthesiologist with Norwalk Hospital. Welcome.
Welcome back, Pooja. This is such a great topic because pain is so prevalent in our society. We all know what it is. And to tell us, how are some of the ways to deal with pain healthily? What's a healthy approach to pain? And maybe we should talk a little bit about different kinds of pain.
Right.
Great idea.
So I think the first differentiation would be acute versus chronic pain. These are words that describe pain that is sudden, that's short-lasting, which is acute. Think of your typical ski injury. Someone's getting put away on a ski lift and they're in a cast, and hopefully within 2 to 3 months they're better. Chronic pain is usually when pain is lasting over 3 months and you're having that residual symptoms over a longer period of time. You know, an accident injury where someone's still feeling their back even 10 or 15 years later, or even just up to a year later. And so the way that our minds deal with both of these kinds of pains can be very different.
Talk about acute pain for a while. That's a normal protective mechanism. It keeps us from getting hurt.
Right. I mean,
or trying not to get hurt.
If we didn't feel that acute pain, you know, I get too close to a stove and I feel that, then we wouldn't be able to preserve our fingertips. Or you see this even in children where they have reflexes. So the fact that we feel pain in those ways is actually, we can be thankful that our bodies are doing what they're supposed to do. Not to say that it's always comfortable and functional for our daily lives.
But important.
But important. So often you will get prescribed medications like ibuprofen, heat, relaxation, massage for a short amount of time to get through those time periods, about 2 to 4 weeks hopefully, and then you could be off on your way, and taper that as you go along.
So as the injury heals, the pain goes away, it's protected you, and it
Yes.
goes away when it's no longer needed.
Yes, ideally.
Ideally.
Yeah.
But then chronic pain's a whole different animal, isn't it?
Now, some mechanisms of injury can turn into chronic pain in and of themselves just because you've had something like nerve damage. So there's different kinds of pain, as we know. There's, there's pain from breaking your leg, which is like bone pain. There's soft tissue pain when you see swelling or a bruise. And then there's nerve pain. Often when you think about nerve pain, it feels like an electricity, kind of like zapping yourself in the like an electric volt. And nerve pain is often the one that's considered the most difficult to reverse and can often be something that people suffer with for years on end.
I think that's really important to mention because I'm not sure that everyone knows that there are really different kinds of pains that are transmitted in different chemical and electrical ways within our bodies.
Right. And some pains, although they may be dull, such as neuropathy, when people say diabetic neuropathy, which means that they're having nerve pain from having diabetes, often in their legs and their arms, it could be a dull background pain, but that does not mean that it doesn't make them, suffer on a daily basis.
Right, even there are certain pain fibers that cause more suffering with the pain, more unpleasant feeling than others.
Right.
And so it can be very complex what the person's actually experiencing.
And each person with, 2 people with the same diagnosis will not have the same kind of pain. Now, I can have a patient that says this is electricity, and someone says it feels like ants crawling under my skin. For some people, nerve pain is so terrible that they wouldn't allow a long sleeve shirt on their arm. And for some, it only wakes them up at night, which is better or worse. So it's very person-based, and that's why when we talk further today, your coping mechanisms will also be very personal and well suited for each person.
So you said some chronic pain is due to, or some instances of chronic pain, to a permanent injury to a nerve or structure that just continues to send those signals. But pain can also become its own reverberating signal, can't it?
Yes.
When the injury is completely gone.
Right. So just because the injury is gone doesn't mean that the neurons in the brain and the whole circuit is turned off. And unfortunately, there are certain people that are more likely to have that sort of pain than others. And it's not one of those things where you can walk down a street and necessarily predict it, but they are related to many factors, which we can talk about in the second segment of the show, about what kind of factors lead to people to have more chronic pain than less chronic pain.
And so everyone's different in terms of their experience of pain and the duration of pain. And so tell us a little bit about how that does affect coping with and treating with, say, chronic pain.
So, well, I will say on my end, my job is to really take each person as a sole person. There is a lot of psychology that's involved in the field, because you can't just say, okay, well, the bone is broken, how do we fix it, and how do we get you off on your way? It's how is this affecting your daily life? What are your roles at home? Are you a new mother? Are you working with a jackhammer 4 to 7 hours a day that involves more of a physical labor? Are you a physician and your headache doesn't allow you to concentrate? So whatever it may be. And also understanding people's ability to cope based on their own history. Now, sometimes you'll have someone that says willingly that I have a high threshold of pain and I don't really want to take too much medication, but give me 1 or 2 tips on how to fix it. And then there's other individuals that say, I, for the next 2 weeks, can't do anything at all. And so I want to be able to sit back and just heal and rest and not do anything. And so I won't say that any of these are totally all good or bad, but each person will have their own sort of package and how to best heal for themselves.
But are there any things that we can teach our patients, or you can teach our patients, to help them cope with pain and thus minimize its effects? Someone who even says I have a low threshold for pain,
Right.
And I just broke my arm.
Right.
How can I reduce the suffering of that, other than taking higher doses of pills of one
Right.
type or another? Are there ways that strategies to help them deal with that pain that may make it more tolerable?
So I think we hear a lot about mindfulness in today's generation, but I think the key is that the mind and body are linked. And I won't say that if you have control of your mind, you won't feel anything at all. That would be great. But there is a huge component of our ability to understand the pain and conceptualize it and know why it's happening, and that, I think, leads to less suffering. I find that when someone comes into the office and says, I have no idea why I'm feeling this and it's driving me crazy, if we find them sometimes a diagnosis or a reason or kind of a story behind it, they're able to put it in a better box and make more sense of it. And although the pain actual degree may be the same in their body, for example, the nerves may still be firing the same, they can cope and deal with it better because they can understand it better.
Well, we know that fear makes pain different, right? And fear can make pain
Yes.
worse. As you're alluding to, if you don't know what something is, that might be really scary.
Right.
And so your ability to know how to deal with it is
Yes.
impaired. So alleviating some of that fear can be really important.
Right, and then also getting positive relationships with doctors. I mean, I have people that come in and say, I'm feeling this back pain, I've been laying in bed for 3 weeks. And my first thing is that that's probably what we shouldn't be doing. Unless, I prescribe bed rest for certain reasons. 90% of the time, complete bed rest is never really what patients should be doing. Because when we don't move it, we lose it. Our musculature and all is meant to be used and kept up.
And this has been proven, too, for folks at home. I think it may make sense to you, well, if it hurts, I don't want to use it.
Yes.
And I need to give it time to heal. But this has been studied in very rigorous ways. And I know it's been shown that if you get up after, you may need 2 or 3 days
Sure,
to
yeah.
let the healing start. But if you can get up 2 or 3 days later and begin to move and begin to try to minimize the effect of pain on your life, you actually recover faster and have less suffering.
Right, and I think that's mental and physical. So a good example is back pain. So someone may have a herniated disc, which is a disc in your spinal column that's popped out a little bit, to the point that it's causing pain, but it's not a medical emergency or a surgical emergency. And I found that people who continue exercise, especially core strengthening, have literally changed their MRI for the disc to go back in. And I think with true dedicated exercise, even if the disc is in itself, because the abdominal muscles and the back muscles are so strong, the posture is good, and the pain will have less of an effect on the daily life. If that person just laid in bed, then all of that would go more mushy, and then the actual spinal disc would be rearing its ugly head and causing a lot more pain than when the whole body is more compact and able to stand up straight and strong.
And so expanding on that a little bit, in many kind of areas where people may have musculoskeletal pain, especially supervised, gentle and then progressive movement may be very helpful. I'm thinking particularly about physical therapy. So people know that they're moving in a safe and effective way, and strengthening parts of the body that may need to be strengthened in order to reduce the pain in the affected area.
Right. A lot of musculoskeletal injury is secondary to overuse, misuse, or even underuse. And so when you go to a physical therapist, they may be able to see how you are in alignment. If you have a right shoulder injury, you may find that over time your left shoulder hurts too because you're compensating, so they can get you back aligned to having both, equally strong and capable. And then I think the most important thing is to take the homework from the physical therapist home and continue, at least once a week so you keep up that musculature. And I think that's great. The physical therapist is a very important person to visit in these situations.
This is also true in elderly people with a lot of osteoarthritis, sort of wear and tear arthritis in the joints. I know it's been shown that exercising those joints, strengthening those muscles, not only improves mobility, but makes people more comfortable.
Yeah, weight-bearing exercises have been shown to decrease osteoporosis, and it's just because you're actually using the bones to increase that mass, and it's a perfect example.
Yoga can also be helpful.
Yeah, so I personally practice yoga about 3 times a week, and even in my short time as a pain management doctor, I've seen in myself that aches and pains that I was going through when I was training or going through some stressful times can truly disappear if you keep up a good healthy flow of exercise. It helps the blood flow go from the head to the toe. It helps easing aching muscles, and so I can say to patients that it's worked for me, and hopefully it can work for you too.
We all have different personalities, but it is true that there are some people who just are able to ignore pain, or ignore may be too strong a word, minimize pain and go on with their lives. Are there any tricks to bringing people who have trouble doing that to that point? Because it really is a definite phenomenon. Some people, the same pain, one will be disabled,
right,
and the next person will be not running marathons, but could be able to continue with their life. And certainly it'd be nice to be able to teach the person who's struggling some of the skills that come naturally to the adapter.
Yeah, and I like how you prefaced it with personality traits, because although we cannot change or treat personality traits, we can adopt different things. I think personally that reading is a big, very simple but large resource for people. There's a lot out there about mindfulness, mind over matter. There's even support groups for such things that people that with like injuries or like sort of suffering can go to and speak about what's helped you. But above and beyond, I think keeping the mind active and busy is first and foremost. Now, if you were a skier and you had a ski-related injury, it doesn't mean you go back into your full-fledged career, but if it means, observing a camp for a few days, or as a physician, if I had something wrong, going in and shadowing someone, just keeping the mind active so you're not removed and isolated from what you were doing before, whether it's athletics or work, keeps the mind happier.
So you're not focused, your mind isn't focusing on the pain, but it's focusing on something else.
Exactly. And you also remind yourself that there's so much more to than just the pain, that we're able living bodies that have many different needs and desires and capabilities.
And unfortunately, that's all we have time for. This is such an important point.
Thank you so much.
And I wish we need to talk about it more, because I think it can help so many people. I want to thank Dr. Pooja Shah for joining us on Health Talk today.
And thank you for watching. Please remember to send us your questions and comments at healthtalk@wchn.org.
And think healthy, and that'll help you stay well.